appreciate you taking out the time. We're grateful that you were willing to do so, to speak directly to our students about the complexities, the challenges, your experiences in a career in public health. So thank you so very much for being willing to do that. I would like to ensure that we correctly address our Masters of Public Health student, Taylor Manzelli. I apologize. I think I might have been reading something wrong a little bit earlier. So Taylor Manzelli is our MPH student. Taylor, thank you again for joining us. We appreciate the time that we've been able to spend together. We're going to transition now to some of the questions that have navigated their way in, and I'll remind the audience again that if there are questions that you'd like to pose of Dr. Bauer, to please feel free to take advantage of the Q&A function to do so. We received a couple of questions so far. We'd absolutely like to try to get to as many questions as possible. As traditionally occurs, we typically receive more questions than we may have time for. So I'm going to apologize in advance that we may not be able to get to all of your questions, but I promise we're going to do the best we can to get to as many questions as we're able to. So let's open up the conversation to questions from the audience.
Sam, sorry to interrupt you, but I wanted to remind you about the lightning round.
Yes, we're absolutely going to go to the lightning round as well.
Okay.
That's typically an audience favorite. And I'm going to take this as an opportunity to actually do that. We want to push that off until a little bit later, but we can absolutely get to it.
No, sorry, I didn't mean to.
Nope, no worries at all. We that's something we typically say for a little bit later in the conversation. We have our lightning round questions teed up. Dr. Bauer looks as if she's ready to go. So why don't we transition to lightning round right now? I'll start with the first question, and Taylor and I are going to be tag teaming on today's lightning round. Dr. Bauer, what is your favorite guilty pleasure drama or comedy TV medical show?
I don't have a TV.
So that's fine. So I'll take a little bit of license and ask if there were a vintage program around the medical or public health space that particularly resonated with you. What might that have been?
You know, I didn't even grow up with a TV. I've heard good things about MASH.
That absolutely works. That's an award-winning program, so we'll take that. Why don't we transition to the next question?
Wow.
Dr. Bauer, what do you view as the most important health-related discovery or advance?
Oh, wow. You know, with what we're struggling with here in New York right now, I have to say vaccines.
Thank you. Thank you so very much. Any junk food? I would imagine that you don't indulge in much, but just curious, what junk food do you typically say is your go-to, or perhaps one that you absolutely want to sample if you have an opportunity to?
So I make a mean chocolate cheesecake, but I don't consider that junk food.
That works. That
Got
works.
calcium in it, doesn't it?
For sure. Taylor?
So one of our favorite leading questions, what superpower would you choose, Dr. Bauer?
Oh, I love that. What superpower would I choose? I'll go with the power of persuasion.
That's a good one. I would like to have that as well.
Dr. Bauer, it absolutely sounds like you kind of have a little bit of that already going on. So if you could hone that even more, that sounds amazing. And our last lightning round question for this evening, your best advice for a long and healthy life?
Oh, no TV. I'm just kidding. My best advice is 8 hours of sleep a night.
Oh, wow.
Keep yourself rested and refreshed.
Thank you so very much. We do have time to get to some Q&A from the audience. We have some questions that have come in, and we'll start with the following question.
I don't get it.
From your perspective, were there any particularly successful communication strategies employed during COVID response that can be built upon and utilized in future health emergencies?
That's a good question.
Yeah, I don't know. The thing about COVID communication is it was a bit overwhelming. And I think the messenger lost control of the message pretty quickly. So, kind of thinking out loud here a little bit, having had this experience of, wow, just really overwhelming people with information, we might want to simplify our approach next time, not to withhold information, certainly, but to really crystallize the communications that we want people to understand, and then kind of stay on top of those so that as they, drift out into the airwaves, we can reel them back as they get misrepresented and misinterpreted. So any strategy that keeps things simple, clear, direct, I think will serve us well in the future.
Thank you so very much. Our next question speaks specifically to populations deemed by the questioner as particularly vulnerable, including immunocompromised populations, those who may not have ready access to paid leave and the like. And the question is framed around the fact that the decline in COVID-19 infection controls has prevented vulnerable populations or vulnerable New Yorkers from entering indoor settings and participating fully in the state's reopening, particularly while up-to-date vaccination rates remain low, stubbornly low. Historically marginalized communities are disproportionately impacted. Can you offer some sense of how the State Department of Health arrived at the decision to lift infection controls, including masking requirements on public transportation and in schools?
Yeah, much of what all state health departments do is follow the guidance from the Centers for Disease Control and Prevention. And in terms of lifting masking requirements, New York State was actually a little delayed in that. That is, we kept our masking requirements around longer than even the CDC had recommended. Both New York and CDC and many health departments have tried to remind people that you can still mask. We have signs in our building saying, please feel free to wear a mask. And I religiously wear a mask every time someone comes into my office, every time I leave my office, every time I go to the grocery store, every time I'm out and about. And I am disappointed to see that not many other people are masking up, especially as we have a virulent flu season underway, and we have this RSV problem also coming on us much earlier this season. So, when we wear a mask, we protect ourselves, we protect others, and we protect our hospital capacity. And our hospitals are a community resource, so we all have an obligation to protect that resource, and we can do that by wearing a mask.
Thank you very much, and I'd like to thank Teresa Hunt and Isaac Michaels for those first two questions. Thank you very much, Teresa. Thank you very much, Isaac. Our next question comes from Sheldon. It looks as if the last name is pronounced Benali. Thank you, Sheldon, for your question. And Sheldon offers that he's affiliated with a tribal college in the Navajo Nation. He's joining us from Shiprock, New Mexico.
Wow.
Yes. So Sheldon is expressing that he believes he heard in your intro that you've had experience working with indigenous populations, including Native Americans and Alaska Natives.
Yes.
What advice would you offer to those populations who, particularly students who are considering entering into careers in public health?
So Sheldon, I am so happy to share with you that I ran the Shiprock Marathon.
We have to
So
add
I
that
have
to
been to
leading
the
questions.
Navajo Nation many times, and have been to Shiprock, and ran the Window Rock, and ran the Shiprock Marathon. So what a treat and an honor to have you joining us tonight. So my advice to American Indians and Alaska Natives who are pursuing a career in public health is to honor the wisdom that you bring with you to that endeavor. That was a long lesson for me to learn. I have visited dozens and dozens of Native nations across the country, and really listened carefully to the wisdom that exists there, and the ways that Native people know to keep themselves and their communities healthy. So helping the rest of our American society respect and understand and honor all of our traditions, it can bring that well-being, can bring that wholeness, can bring that healing. So my advice is to honor that knowledge.
Thank you very much, Dr. Bauer. I would like to take an opportunity as questions continue to come in to thank our sponsors. Thank you so much to the University at Albany Office of Government and Community Relations. Thank you to Dean Gallant and the School of Public Health. Thank you to the Office for Public Engagement, to the Center for Leadership and Service, and to the Office of Diversity and Inclusion. Thank you so very much for your robust support of this program, and thank you for continuing to go about the work of collaboration to ensure that we're able to bring valuable programming like this to the University at Albany community, both local and not so local, particularly as in the case of our last questioner, Sheldon. We have another question, and this is coming from Christine Boslak. She offers thanks for this event. Christine, you're more than welcome. Dr. Bauer, what inspired you to go to work at the New York State Department of Health?
So I first joined the New York State Department of Health in 2001. I was actually working at the Florida Department of Health at that time. And my husband's family was in Eastern Massachusetts, and my family was out in Ithaca in Central New York. And we had a young family, and we really wanted to be back home, closer to our families. So we came to New York the first time for family reasons. I left the state, however, and joined the CDC in 2010. And when I did that, my husband and children did not come with me. My kids were in middle school and high school at the time, and they wanted to stay put. So I did that commuting thing for 12 years. And that was enough. So during the pandemic, of course, the federal workforce got sent home, and that was a huge treat for me to be back in upstate New York. And I started to worry. Do you remember just before Delta hit, that it looked like COVID was going away in May and June of 2021. And I started worrying that the federal workforce would get called back to work. So I looked for a local job, and I was delighted that there was an opening at the New York State Department of Health. So I guess family reasons are both for both times why I came to the department. It's an extraordinary department. It's an academic health department, which is not the typical model. We have a great partnership with the School of Public Health and UAlbany. We have a lot of resources. We have a very progressive program. We serve a lot of people. It's really an honor to work there.
Could I ask you a follow-up question on that? And first of all, I'm I'll say that I and our school of public health delighted you came back to the state health department. But can you talk a little bit about the difference working in sort of leadership positions between the federal government and state government? Maybe differences and similarities, I don't know.
Yeah, so one key feature of our federal system of government is that the federal government can go into debt, but state governments cannot. State governments have to balance their budgets, and the federal government can spend gobs of money it doesn't have. So that means the federal government programs and agencies have a lot more resources than state agencies and programs do. And you notice this in every aspect of the work. I remember when I went to CDC, just feeling the quality of the paper in the printer. I couldn't believe it. And we had colored cartridges at CDC. We weren't allowed to purchase those at the New York State Department of Health. So at a very fundamental level, there's a huge resource difference. Mm-hmm. And the salaries are very different too. And that means that the federal government really has a recruiting advantage and can attract the best and the brightest. But they also have resources to invest in their staff and invest in their programs. And many states and local governments too really struggle to do that. On the other hand, Mary, if you want to have an impact, right, the local and state is really where you want to be. That's where you are touching people, where you are building programs on the ground, where you are discovering innovative solutions. I think of local and state health departments, communities as really petri dishes of innovation. So the federal government can provide guidance, can issue best practice statements, can fund particular approaches, but really it's the people on the ground who figure out how this is going to work in my community, or if it's not going to work in my community, what I need to do to make something work in my community. And then that trickles back up to the federal government. So innovation, impact, touching people, changing lives, transforming communities, that all happens at the state and local level.
That is such a comprehensive answer. And my hope is that for any of our students who are considering careers possibly at the federal level or at the state level, they've been able to walk away with enough information to make a decision based on the perspective that you lent and also the things that they believe they wish to do. So thank you very much for that. And Dr. Bauer, I promise you, you're not the only one who was happy that there was an opening with the New York State Department. We are also. We have another question, and this is from Naeem Al-Sadat Madani. Thank you very much, Naeem, for your question. Naeem offers the following. Thank you so much for this great webinar. You are more than welcome. Thank you again, Dr. Bauer, for being here. And what Naeem is hoping to hear about is, what do you view as the best strategy to solve the health insurance problem? So Naeem, I promise you this isn't a policy discussion, but we'll just ask for top of mind thoughts, Dr. Bauer, relative to how to remedy, solve for, navigate the fact that there are many among us who may forego visits to healthcare professionals, including dentists, including eye specialists, because they don't have insurance.
Yeah, it's such a great question. It's really the question of our time. You know, we have this concept of the U.S. health disadvantage. And the U.S. stands alone among wealthy countries in terms of, our high burden of illness, our lower life expectancy, our lack of access to healthcare costs. to healthcare, and yet we are paying more for healthcare than any other wealthy nation, any other country in the world.
Period. That's right.
Twice as much as the average of our wealthy colleagues. So we're paying this extraordinary amount of money for healthcare, and yet we're not getting the benefits. We have sicker populations. We have lower life expectancy.
She's 100% right about that.
So it's a problem to solve. And again, as with the gun violence problem, we can look around at other countries and we can see how other countries, our neighbor to the north, organize their healthcare delivery and healthcare access. There are models out there that we can implement that will serve us better. You know, part of our culture as Americans is we think about pulling ourselves up by our bootstraps. We think about being independent. And that contributes to kind of a zero-sum notion that if other people are going to get something like access to healthcare, that means I'm going to get less of that. And if I already have that, then I don't want to give it up. We don't have an idea of an expanding pie or lifting everyone up actually enriches us all. And many countries have that understanding of the common good. And if we can provide health care to all, then we can reduce healthcare costs. We can have a healthier population. That means we're paying less for things that we don't need to be paying for. So we have an immediate problem now of how do we serve people and help people be healthy who lack access to our health care. But there's a longer term solution out there that as a people, as a government, and as a nation, we need to figure out how to embrace.
Dr. Bauer, thank you for those words to not only give us information, but also words to challenge us and consider the things that we can do as citizens to advocate for some of these changes. Thank you very much. We have an opportunity to squeeze in one final question before we go to our closeout. And that question really speaks to interagency collaboration. The question is, the pandemic, I apologize, let's go to this one. I apologize. How is the Department of Health working with the questioner is asking specifically about the Office for People with Developmental Disabilities, but let's expand that question to speak to other agencies, including OPWDD, to ensure the health and well-being of persons with disabilities in New York State.
So I think you're getting at kind of breaking down the silos and working across programs to solve some of these thorny issues that are plaguing our state and our nation. It's a tough one to solve, and it's ironic because we all want to solve it, right? We all want to work together. And every time we have the opportunity to work together, to work with other agencies, to engage with other programs, even outside of state government, we so appreciate that opportunity, and we learn so much from it. I think where this works best is when you have a bunch of different types of groups. You have government, you have nonprofits, you have businesses, you have community organizations, all working together to solve a particular problem. And they can work across those silos much more easily because they're all focused on a specific and definable problem to solve. For state agencies, we're also overwhelmed with the host of problems that we're charged with solving and the programs that we're charged with delivering. it often seems difficult to kind of get our heads above water and look out and say, oh, Office for People with Developmental Disabilities is doing something similar. I need to work with them, or Office of Mental Health can help us solve this particular challenge. It becomes overwhelming to do that outreach and then to kind of stick with it and bring it to fruition. So it's the holy grail of how we can make progress in a state or federal government, or even at the local level. And it's a nut we just haven't cracked yet, to mix a bunch of metaphors there. Sorry.
Dr. Bauer, we appreciate your perspectives. We appreciate the reminder that it requires a diversity of lived experiences, learned experiences, professional experiences, and otherwise to solve increasingly complex problems. So yes. Diversity of populations and diversity of perspectives is just one way to help us get there. I think your message comes through loud and clear, and I thank you for sharing it. Are there any final thoughts that you'd like to leave us with before we offer our final thanks to the audience tonight?
This has been really such a wonderful experience for me. I really appreciate the opportunity. It was great to meet you, Sam, and Taylor, and Mary. Of course, we'll continue working together. And I appreciate the audience. I appreciate folks coming out from across the school, across the state, across the country. I really enjoyed your questions, and I wish the School of Public Health students great success in your careers as we solve these important public health problems.
Thank you so very much. Sheldon does offer a reminder that the Shiprock Marathon is in May. So thank you, Sheldon. We appreciate that. And I realize that we're right up against time. We do have a question from a student, and I really do, as much as we can, try to accommodate those questions. So we have a question from a student, Andrew Clancy. Thank you for your question, Andrew. And he's asking just briefly if there was advice that you had for MPH students in navigating through the politics that inevitably affect their work. So he doesn't offer anything more specific than that. Andrew, we thank you for your question. And to the extent that you can, Dr. Bauer, that's something you could touch upon briefly, please?
Yeah, politics is part and parcel of public health. I think that's always been the case. But I think it's become increasingly the case. So you do have to hone your political sensibilities. And certainly if you're going to be a local public health commissioner or even a state public health commissioner, you're reporting to a county executive, you're reporting to a governor. That doesn't mean that you're inauthentic or that you compromise your positions, but it does mean that you're listening carefully to the diversity of perspectives, that you're understanding how those shape your perspective and how you can try to shape those perspectives as well. So you need to stay true to yourself, but not in a dogmatic way, in an open way that recognizes and appreciates other perspectives and tries to find common ground.
Dr. Bauer, our final comments are grounded in gratitude. Thank you for joining us this evening. Thank you for sharing time and perspectives from the New York State Department of Health. We're grateful to you for your public service, for sharing aspects of your personal journey, for lending insights both on leadership and the practicality of the work with our students this evening. And we do hope that your schedule affords you an opportunity to be able to join us again soon. Thank you so very much. Audience, thank you for joining us. Please keep your eyes and ears posted for upcoming events relative to leading questions. Thank you very much, Dean Gallant. Thank you very much, Taylor Manzelli. Thank you very much, sponsors. Have a great evening, and we look forward to seeing you at our next event. Take care.
Thank you all.
Thank you, everybody.
Recordings